I'm Nikki Holland. Last year I was working as a professor for a local university. I have 3 wonderful, beautiful kids and I am engaged. And before all this was very active. Did running, working out, adventures. Nothing really stopped me. I did have asthma, but it was very well controlled for the past 4 or 5 years. And wasn't having any other issues. At the end of last year, I switched to home health full time and received my second Moderna COVID vaccine on February 12th. Within 48 hours, I had profuse vomiting, and this did improve, and I was able to work a couple days, but I noticed that I was having more difficulty breathing, thinking that I was having issues with my asthma. By February 17th, it became so bad I had to be admitted to the hospital, and 1 week later was on the ventilator. This was exactly 1 week from receiving the Moderna shot. I only had to be on the ventilator the first time for about 3 days and then was weaned off. However, this did not last, and I was put back on the ventilator a second time due to decline in breathing. But again, breathing declined and I ended up on the ventilator for the 3rd time. This time, they life-flighted me to a larger hospital, and I stayed on the ventilator longer as they were having trouble weaning me off. They were having trouble weaning me off due to laryngeospasms, however, were successful eventually, and I went home on nasal cannula. I was excited to go home and see my kiddos and the rest of the family, in which we celebrated an early birthday for me. However, this didn't last long, and I was still having cramps in my right leg, which I was in the previous hospital visit. And come to find out, I had a DVT and possible pulmonary embolus with difficulty breathing. So they life-flighted me to a larger hospital. Once they had me on blood thinners, I started to do well, however was having a lot of difficulty bleeding. During this hospital stay was my 37th birthday, and my fiance helped me celebrate it in the critical care unit. I continued to improve and was able to be released the following week. After that, I enjoyed my first week home. However, I started to have abdominal distension and some nausea and vomiting, dizziness, sweating, and heart palpitations. My primary care advised me to go to the ER, which I did, and they advised me nothing was wrong, even though I looked 8 months pregnant. 1 day shy of a month I spent at home since the last hospitalization, but then I noticed I had a GI bleed and continued to have abdominal distension. So they took me to the hospital and was life-flighted out to a larger hospital with a GI. During this time, I underwent an EGD and a colonoscopy. However, coming out of anesthesia, I started to have laryngeospasms again, and they had to intubate for a 4th time. This time, they stated that they were sure that I was having vocal cord dysfunction, and it was causing my vocal cords to collapse down, causing the stridor and difficulty breathing. So they stated that I needed to go see a vocal cord specialist when I left the hospital. So when they discharged me, I went to see an ENT who specialized in vocal cord dysfunction. She showed me that I did have some issues with closure and taught me some exercises, stating that this would help next time to open up my vocal cords and prevent intubation. However, things did not go as planned, and when I went to my pulmonologist for a regular visit 3 days after I was released from the prior hospital, he stated I needed to be admitted due to my breathing difficulty. They loaded me up on steroids and medications, and breathing improved, and I got released to a regular room over the weekend. However, by Sunday, breathing worsened, and I had to be placed on a vent, and they life flighted me out to Vanderbilt in Nashville. My lungs were improving, however, my throat was spasming, and they couldn't extubate me without risking the potential of my throat closing off with a laryngospasm. So they took me to the OR, and when I woke up, I had a trach. I could now breathe, however, I was breathing through my neck and was unable to talk nor eat. With the blood thinners that I was on, I was having a lot of difficulty with bleeding and coughing up blood, and this lasted several days. After about 2.5 weeks, I was able to sit on the edge of the bed with help, but I had lost a lot of muscle mass and had atrophy all over. It was very difficult. At this time, though, it was also noted that I was having some neurological issues with my legs and my bladder. I couldn't feel my feet. They felt like walking on bricks. Every movement, including just rolling over in bed or standing up, took significant effort and help. When the catheter was pulled, it also became apparent that I could not sense when my bladder was full. The doctors were concerned that I was having the laryngospasms, as well as upper motor and lower motor neuron issues, and were concerned that this may be a progressive neurological disease. However, due to the critical myopathy I was having from weakness, wanted to wait until I was at rehab to see if I regained strength. I spent 18 days of several hours of therapy a day, speech, occupational, and physical therapy, working on walking and strengthening the muscles I needed to safely be able to go home. When I did go home, I had a lot to learn with all the equipment needed. When I went home, I had several new equipment. I had my walker, oxygen as needed. I had a midline PICC line, my feeding tube for supplemental nutrition, medication, tons of it. And then I also had my humidifier suction machine and my bag valve mask in case there were any emergencies, which now I have progressed from my walker to a cane to now a loft strand crutch. However, it's become a lot more difficult for me to use as my hands are getting weaker. This was all a bit overwhelming, but the good thing was the people that I once called my work family had now became my home health. Those same colleagues were my physical therapist, my occupational therapist, my speech therapist, and my nurses, and for that I'm very thankful. At home, I tried to work out the best I could with walking and exercises to try to maintain what I had and progress further. However, this was difficult, but I was able to progress from a home setting to outpatient therapy. And I progressed to outpatient physical therapy, and strength and core and balance were the targets, and they did improve some. However, not enough to become more mobile and efficient enough to return to work. We were very fortunate to be able to go on our family vacation. However, this was very tiring, and this trip made it apparent that their original diagnosis of critical myopathy was wrong, that this has to be something more and neurological as well as progressive in nature. I've been having more symptoms. I started to lose my hair in clumps. I also noticed that my tongue was starting to have fasciculations like other muscles in my body. This is random involuntary movements that you can see right here. Another thing is my feet would jerk at night. This is what it would do without me moving a muscle, all on its own. These little fasciculations will occur throughout my body in different muscles throughout the day, on and off, but worse at night, making it very difficult to sleep and relax. In addition to the fasciculations and twitching, I would have muscle spasms as well, which you can see one right here. These occur in several parts of my body throughout the day. They performed an EMG and a nerve conduction study, and the nerve conduction study was normal, meaning I don't have a demyelinating disease like Guillain-Barré or MS. However, they were seeing activity on the EMG which showed distant motor neuron activity, meaning that the problem was in the brain or the spinal cord. Also, all my imaging with MRIs and CTs and blood work have come back clean, and this was the finding that was pointing to a progressive neurological disease. Right here, you can see the difference. See how this is bigger right here? Got like a lump, but then on this side, it's very flat, shut down. And so, it tells me that I'm losing muscle. So, also, when I go to straighten my hands, so I straighten my hands just like that. I can straighten this one pretty flat, but this one I can't. And so that's one of the things I've noticed. So another thing that I noticed was my voice seems to have been changing, and I'm having more difficulty getting some of the words out, and almost like a slurred voice, especially when I get really tired. Also, if you've noticed in this video, I've had nystagmus, and it seems to come and go, but mainly when I'm not completely focused or tired is when I see it the most. Since this has all started, I have been hospitalized and intubated and life-flighted multiple times. I have been intubated a total of 5 times and ending with a trach, and have spent 50 days in the hospital out of 98 and 18 additional days in rehab facility for therapy to get strong enough to come home. I have kept up with all the records and have much paperwork and CDs full of data from all of my hospital stays, which I have already submitted it to the vaccine registry VAERS, and they have contacted me from the CDC and have pulled all my medical records themselves. I think one of the hardest things was looking back at the notes that I wrote while on the ventilator. I was frustrated. I was torn apart. I was scared. I had to ask people to do simple things that I couldn't do myself. I just wanted it to all end and stop cycling. So I was sent to several specialists other than my primary care, including a cardiologist, a urologist, my pulmonologist I was already seeing, a GI, an ENT, and home health and outpatient therapies. At the last neurologist visit, he said that I needed to be sent to someone that better dealt with what I was dealing with. And that's when they made me this appointment. I have an appointment October 1st with the ALS clinic at Vanderbilt. Most people say correlation or causation. I don't know for sure, and they may never know whether this was triggered or directly caused by the vaccination itself, but it resulted directly afterwards. I'm scared and frustrated, and all I know is I don't want to live nor die this way at 37. Sometimes our minds are our worst enemy or our greatest motivator for the things that we love. However, sometimes our mind can't overcome the physical changes in our body. No matter how much you tell it that you want to live and that you want to be better and you want your old life back. I'm not an anti-vaxxer. I believe in vaccines. However, I also believe that there are side effects, there are adverse effects, and I would not wish this on anyone. The problem is that when we come forward, we are being shamed, and we are being ignored, and we are being censored. I've seen it through social media and through the medical community. The common good philosophy in vaccines is what must be done a lot of times. However, when you are that statistic, you are that one, you just want to be heard and helped. I want my story to be heard.